Hello, everyone. Nice to meet y'all. I'm Joyce, like Charles said. I'm a physical therapist with Movement X. I'll talk more about that, but Charles had one thing wrong. I like my feet in both worlds of orthopedic and pelvic floor, and hopefully y'all will see why at the end of the presentation. So you can go to the next slide. Okay, so just a little bit about me. I'm from Houston, Texas. I went to school at the University of Florida, University of Miami, physical therapy school. Made my way up here 3 years ago, and I've been enjoying it. I specialize in orthopedic and pelvic floor physical therapy. I'm really passionate about having my feet in both worlds because I think our bodies are complex and you can't ignore something just to treat one thing is how I see it. And I like to treat the whole person, not just the body part. I have advanced certification in pelvic floor physical therapy, dry needling, and ACL rehabilitation. I have outpatient clinical experience before I transitioned to working with Movement X, which is a mobile concierge physical therapy practice where we can really spend one-on-one time with you and not be distracted by the chaos of a PT clinic. I'm really passionate about education. So when Charles was like, can you do this? I was like, yes, I like talking about what I do. So I'm hoping y'all will learn something today. Movement, of course, and then empowering people to be the best versions of themselves. All right, so I want to start with common misconceptions that people have about pelvic floor health, pelvic floor therapy. You may be like, I've said one of these, that's okay, I'm not here to judge. But first one I hear a lot is pelvic floor health only applies to women. Every single person on earth has a pelvic floor. That means anyone can have pelvic floor dysfunction. So I really like to highlight that because a lot of men sometimes are like, I don't know what to do. I have this issue, or they don't realize it's an issue. And it's like, there's actually people who work on this. So unfortunately, I only am certified in working with women. But if you ever need a resource, I can always help you find the right direction. Another misconception is that pelvic floor health only matters if you're postpartum. That is another false statement. Not only does everyone have a pelvic floor, but pelvic floor therapy is relevant at any phase of life. I would even argue that it's actually really important before you get to the point of pregnancy or even during. So you don't have to be postpartum. You don't even have to have been considering pregnancy at all to benefit from pelvic floor therapy. My pelvic floor is weak. I hear that all the time. A lot of times you see that on the internet. You hear that from other medical providers. You hear that from your friends, your family. A lot of people think that when they have an issue, it means they're weak. And I will say in most cases, that's actually not true. This is why a pelvic floor exam is really necessary, because you really want to get to the root of why am I having this issue so I can actually do the right thing about it. If your pelvic floor isn't weak and you're Kegling all day, you might be making the problem worse or not really addressing the real issue. So that's why getting a good assessment is very, very important. Going to pelvic floor PT is awkward, uncomfortable, embarrassing. Now, of course, this is subjective, but pelvic floor therapy is designed to address your pelvic floor issues. So as long as it applies to your pelvic floor, it is not TMI, it's not inappropriate, it's not weird to bring up. I want to know what's going on so we can make sure we're addressing all of it, right? And also the examination and the treatment is done in the privacy of a room. You know, no one else is around. It's just us. We're just talking. And it's kind of designed to address, sensitive, intimate area, but it's necessary. And then finally, it's too late for me to do anything about it. I hear this a lot too. As people get older, they think that they can't resolve an issue that's been happening for whatever amount of time. I work with people as young as 13 and 14 with pelvic floor issues, all the way up to like 80, 90. It's never too late. It's never too early. Anyone can benefit. All right. So what is your pelvic floor if you don't know? I included pictures of male pelvic floor muscles, female pelvic floor muscles. Again, everyone has a pelvic floor. It's relevant to everybody. Pelvic floor consists of muscles, ligaments, bones, joints, nerves, and your organs. So there's a lot of structures here that can have an issue that needs to be addressed that can be contributing to your pelvic floor problems. So these are just some pictures of what the muscles look like. A lot of small muscles, so you'd be surprised at how much goes on in such a small area. Okay. So your pelvic floor has 5 important functions. So I'm just gonna go through them. One function is organ support. So your pelvic floor acts like a hammock to support the organs, make sure that they're staying in the right place. We don't want them to droop or drop because that can get very painful and uncomfortable. Something we don't want to happen. They help with bowel bladder function, so that's that sphincteric function. It keeps things closed when they're supposed to be closed and helps things open when they're supposed to open. Of course, sexual reproductive function, self-explanatory. And then circulation. So your pelvic floor consists of veins and lymphatic vessels that help with circulation, blood flow, and also like waste removal. So people can sometimes get congestion or swelling in the area. And then finally, core support. So your pelvic floor helps with lumbopelvic stability, which is stability for your back and your pelvis system. So lots of roles that it plays. So you can imagine a lot can go wrong sometimes if it's not up to par. So people hear the term core and think it's just the abdomen. That's not true. Your core is actually a system, and it consists of your diaphragm, your multifidi in your back, your pelvic floor, which is the star of the show today, and then your transversus abdominis. All of these are working together to create this core system. So if you're just addressing one thing, you might be missing something else that needs to be addressed. So I use an analogy of a group project a lot if you work with me, because I think we all know what it feels like to be in a group project and somebody's not doing their job and you have to do a lot of their work. You don't perform as well. You get stressed out, you get annoyed, you get frustrated. That's what's happening if something in this core system isn't doing their job. So when you have an issue and you're like, it's just one thing, a lot of times it's not. So my approach is really addressing all of this, not just one thing. So next slide. Yes, so this is a list of all the different ways pelvic floor dysfunction can look like. I will say in most cases, people just don't have one issue. A lot of times it's a combination, and that just goes back to that core system. So one of them is prolapse. So that's when the organs are falling down, and that can lead to people feeling like pressure, heaviness, pain. Some people go as far as saying like, I actually feel the organ out of my body. That can be a very severe grade of it. So clearly something that's not normal, so can be addressed with pelvic floor therapy. You have leakage, so that is bowel and bladder, not fun. You also have urgency. So I'm sure someone knows one person who, like, if you have to go, nothing else in the world matters but you getting to the bathroom. You stop everything you're doing. There's no concept of I need to hold it. That doesn't exist for you. That's an issue, okay? So if you feel like you're running to the bathroom because you just can't control it and voluntarily go and take your time, we can talk. If you are somebody who you get to the place, you gotta go. You're in the middle of being there, you gotta go. You're about to leave the house or the place, you gotta go. That means you're going way too much. That is a frequency problem. So you can go too much, you can also go too little. So normal frequency is 2 to 4 hours. So for the people who are in healthcare, that was me in the clinic, teachers, busy professionals who have meeting after meeting after meeting, if you're not going every 2 to 4 hours, your frequency is off, and that can be related to pelvic floor dysfunction. So going too much is a problem, going too little is a problem. Diastasis recti, this is commonly associated with pregnancy. A lot of women will say, oh, like my abs are separated, I have I see a bulge here or the dip here. It's basically a functional core weakness or an abdominal separation. It doesn't only apply to postpartum women or pregnant women, but it's commonly associated in that category. But even men can have diastasis recti as well. And even I would say hernias are also related to pelvic floor dysfunction. Constipation is another one. Again, you need to go regularly. If you're not, there could be something going on in the system that you need to address. And then finally, pain. Pain can be related directly to your pelvis. You can have pain with examinations or pain with intercourse. That's not normal. But what I will like to highlight is that you can have pain in your back, your hip, and your abdomen that actually can be coming from your pelvic floor. So this area can refer to other parts of your body, but you might actually be surprised has a connection. So if you're somebody and you're like, I've had back pain for years, I've done all the things, nothing's helped, or it helps a little bit, but there's still an issue, and you've never had your pelvic floor looked at, this is probably a great time to take a closer look because you might find a connection there. Okay, so how can pelvic floor PT help? So the first step is an examination and an assessment. We need to know what's going on, what is associated with it, so we can know the right way to address it. So I kind of broke down how the plan looks like. So first is a history set portion. So history, and I mean everything. Everything is relevant, okay? I wanna know what your lifestyle is like. I wanna know about your medical, your surgical history, what you're eating, what you're drinking, if you've had any injuries to your stomach, your legs, your hips, your back, what your habits are like, because your pelvic floor is influenced by all of this. Might be a shocker, but it's influenced by a lot of things. Next, I wanna do an external examination. So it just goes back to my group project analogy. If your pelvic floor is within this system, this bigger system that's not working correctly, it's not gonna do its job the best it can do. So you wanna make sure you're zooming in and we're also zooming out. So when we zoom in, we do an internal examination. This is what I'm trained to do, where we examine the pelvic floor to make sure, we know how strong it is, to make sure we know if there's any points of tension, if there's a lack of strength anywhere, if there's lack of coordination, really understanding how your pelvic floor is functioning so we know the right tools to give you. I will say, women who've been to the gynecologist, I heard it's way more comfortable doing a pelvic floor exam and PT. So just, if you're nervous about it, I promise it's better than going to the gynecologist. And then finally, or the next, we want to create and implement the right plan, an emphasis on right plan. This goes back to, okay, if you're like, I have dysfunction, let me do Kegels, it might not be the right plan for you. So this is why this is really important. So sometimes the plan consists of lifestyle adjustments. So that relates to, how often you're going to the bathroom, what you're eating, what you're drinking. Maybe your stress levels need to be addressed. Retraining strategies. So sometimes I refer to pelvic floor therapy as adult potty training, because sometimes we have to learn how to go to the bathroom again because we forget. Exercises for strength, mobility, and coordination, and then nervous system desensitization. So there's a lot of different things we can do to address it, but this just goes back to making sure it's the right plan for you. And then the third thing that I think is really important is collaboration. At the end of the day, you are the leader in your care and your plan. So I'm just helping guide you into the direction that you need to go, but you have to make the choices, you have to make the decisions to actually make the right changes so you can ultimately see the benefits. And then collaboration is so important with pelvic floor health. Collaborating with other healthcare providers, collaborating with nutritionists, your therapists, coaches, trainers, pretty much anyone that can play a role in how your pelvic floor functions. It's important that we're all on the same team to make sure that we're all addressing the right things. At the end of the day, your quality of life is improved, which I think is very powerful. There's no reason why you feel shame or embarrassed or that you can't do the things you want to do in life, because it's something that actually can be addressed. And next one. So if you feel like you're ready to take action, I do pelvic floor therapy here at Revolutionary Fitness. I do in-home, I go to offices, I do virtual, pretty much anywhere in not anywhere, but a lot of places in North Virginia. But pelvic floor therapy I could talk about a lot. I know this was a short presentation, so I didn't want to give you information overload, just a kind of a general idea of what to expect. But I wanted to give time for questions or comments anyone had about pelvic floor.
How do you actually give a pelvic examination?
Yeah, so I do a pelvic exam by doing digital palpation. So it's a glove finger with lubricant, so comfortable, I promise. No tools are used at all. And we'll do it in different positions based on your specific concerns. And then that gives me feedback about what we need to address. Does that make sense?
Is it the same for a man? How do you give a man?
They would do the same thing, yeah. So it's not weird, but with men, you'd go rectally. With women, you can do vaginal or rectal, just different anatomy. Any other questions? Well, if you have any questions, I'll be at the table. I know there's a lot of stuff, yeah.
What is dry needling?
Dry needling, yeah.
The topic that you mentioned.
Yeah, we can talk about dry needling. So dry needling is thin needles that are inserted into muscles that are tight, that are causing pain, that aren't functioning well. So the needles are inserted into that muscle. You get a sense of like a muscle twitch in some cases, you get crampiness, like a little bit of an achiness, but after the needle's removed, you get relief and reduce tension, reduce pain, and helps with motor unit recruitment. So really effective, and Natalie and I are both certified in it.
Yeah, do you do it like on the lower back?
Yeah, I'm certified whole body. I do it a lot in pelvic floor as well. I found it to be very effective. You can actually needle the pelvic floor. I haven't taken that coursework yet, but when I needle pelvic floor patients, we'll usually spend a lot of time on adductors, lower back, hip flexors, and even the abdomen. Mm-hmm.